All right, so let's talk about it. This news that broke yesterday, but we need to, clear up some confusion and answer a lot of questions that a lot of parents and a lot of families are asking. So let me set it up like this. So making sure children are up to date on their vaccines. Is on many families' back to school checklist. President Trump on yesterday signed an executive order that would space out the vaccine schedule for measles, mumps, and rubella. All right, joining us on the program from Novant Health, Dr. Catherine Olmstead. Dr. Olmstead, thank you for joining us.
Hi, good afternoon. Thanks for having me.
There are a lot of questions. There's some confusion too regarding this executive order, this new vaccine schedule. The biggest question I've been getting, what should parents need to know moving forward?
I would encourage parents to know that the executive order did not change anything for their children for the time being. And so vaccines remain available and supported. Pediatricians welcome discussions about all aspects of their care and can talk about the risks and benefits of vaccines and their concerns. And they can continue to follow their vaccine schedule as they have been doing at this point.
And just sort of to reiterate, so if I'm a parent and I wanted to follow this alternative schedule, how would that work? That would be sort of just a consultation with that pediatrician?
So there are a lot of factors that go into the recommendations that were made yesterday in the executive order. And one of the components was about breaking up the MMR vaccine. And at this point, the MMR vaccine has been the CDC's universal recommendation since 1971. And we have many decades of evidence to show that that is a safe and appropriate way to vaccinate children for measles, mumps, and rubella. We don't have individual products right now that are available for families who would prefer to give 3 separate shots in order to vaccinate. And so we really encourage at this point for families to continue to follow the CDC's recommended schedule.
What are, and I mentioned this earlier about some concerns from medical experts, but what are some of the known risks for children on this alternative schedule?
The biggest concern as we see it is that we do see vaccine-preventable illnesses in our communities even today. And we were talking about measles, for instance. We recently saw nearly 1,000 cases of measles right over the state line in upstate South Carolina among an unvaccinated community. And because we live in a region in North Carolina that's so highly vaccinated, and communities, surrounding communities in upstate South Carolina that are highly vaccinated, we did not see spread outside of the unvaccinated community. And so the biggest risk really to delaying vaccines is that the child would be vulnerable for a longer period of time. And if children are not vaccinated, we do run the risk of spread of vaccines that at one point were very deadly, very dangerous to children before they had access to vaccines.
I thought it was important for me to ask this before I let you go, and you've been so gracious with your time. But what should parents know that maybe hasn't been put out there, or maybe that hasn't even been asked?
It's important for parents to know that the state still has the ability to make their vaccine recommendations and requirements for school. And so entering into the 2026-2027 school year, North Carolina has not changed its vaccine requirements. And so we still need to make sure that all of our rising 7th and 12th graders are getting their meningitis vaccine, make sure our rising kindergartners have had their hepatitis B vaccine, in addition to the other vaccines that remain universally recommended on the schedule. And I would also encourage parents who have questions to turn to a trusted pediatrician. We welcome questions. Our job is to help families understand the evidence and help make decisions that keep children healthy and protected.
You just hit on it. That's the biggest thing. Just talking to your pediatrician. You guys know the answers. All right, Dr. Olmstead, thank you for your time. Many kids are headed back to school starting tomorrow in Cabarrus County and some other counties, and then following up the next week. All right. Again, thank you for your time, and thank you for clearing up some of these answers and some of these questions that, parents have and have been asking since yesterday. Thank you for your time.
Thank you very much. Have a great afternoon.
You too.